Okay, you ready?
Ready.
All right, so tell us your name and where you work and what you do.
My name is Colleen Babcock. I am a parent and family support coordinator for Horizon Health Services. I am the program director of the therapy dog program at Horizon Health Services, and I am the program director of the Alden Substance Abuse Prevention Coalition.
Wow, so what do you do every day?
I help people. I help people in many capacities. I help them navigate the path to treatment and services. I help them understand the disease of addiction, substance use disorder. I provide hope. I provide guidance. I have found many ways to do that throughout my career, the therapy dogs being one of them. And, I take one day at a time.
Tell us what brought you to your career path.
Well, in 2012, my son was diagnosed with substance use disorder and addiction, and by the grace of God, I found my way to Horizon Health Services. Back then, access to services, especially for an adolescent, was very difficult. You could not find help, and you also were told back then you had to fail at one level of care before you could access the very needed level of care to get help for your loved ones. And in my journey through Horizon, I learned so much about, primarily adolescent addiction, but addiction in a whole, and how to best support my son and navigate those services. And I was just blown away by what I learned in their family program that I wanted to take that message back out into the community. And my son and I started, and several other people from the Alden community who were also touched by addiction started the Alden Substance Abuse Prevention Coalition in our community. And our school was amazing to provide that support to help us get, on our feet. While Christopher was in treatment, I had always had therapy dogs, so I asked if I could bring the dogs to treatment while he was in treatment. And it was, it was like every other time you walk into a room with a dog, the whole atmosphere changes, the mood changes, and these dogs just kind of broke down barriers for people who were in treatment for substance use disorder and addiction. Many times, especially at this time, there was a large young adult population that was entering the treatment programs. And, they were broken. The family dynamic was strained. There was fighting. There were arguing. There was no talking. And these dogs just had a way to break down all those barriers, and people started smiling. It was a very fulfilling feeling. My girlfriend, Cindy Goss, her and I started to take the dogs to Horizon regularly. This was before I started working there. And as I went through the journey, the more I learned, the more that I felt I could do good in the community. So I approached the CEO when my son finished treatment and said, you guys do a great job here, but nobody knows you're here. Who's helping people out in the community? And I said, I think I can really help you. I subsequently retired from a 25-year in banking, and she created this position for me. And it's the first position in Western New York and New York where there was a family advocate that was a member of a treatment program. I donated a dog to Horizon, the first therapy dog that worked in a residential program. Started working for them, and today we have 11 dogs on staff that work in our program. My position has become a New York State credentialed position through OASIS, and we all together feel like we changed the world a little bit.
Those dogs help to provide hope with the work that you're doing to the community.
Well, I think the dogs played many roles, right? When I first started, we were in an environment where people were not talking about addiction. It was still very taboo. Schools weren't, where they are today. Today they're amazing, but back then there weren't the educational programs in the schools talking about addiction, and people were afraid to, navigate that highway. And I had a hard time. Part of my role was I wanted to get into the schools to talk to people to say, hey, we're in the eye of the storm. There's bad things happening and it's coming. We need to prepare these youth. We need to talk about this. We need to educate families. And it was very hard getting into the schools. So I created a therapy dog presentation. And the therapy dog presentation talked about the benefits of therapy dogs, emotional support dogs, and service animals, and the differences between them. And it gave me an opportunity when we talked about therapy dogs to talk about Horizon and what was happening, how we were seeing a changing face in addiction, and that this face was that of an adolescent who was either being prescribed these medications or getting them off the street, but they were deadly. And they were very quickly grabbing hold of an adolescent brain. And the more that I did that presentation, the more, schools opened up and invited me back. And, it became everybody loved the dogs, but it became an opportunity to talk about something that was much more important. In Horizon, the dogs are used in our residential program. So there's 4 dogs on staff there now, and they help, people in recovery to, regain responsibility, to be a part of taking care of the dog. We use them in our outpatient programs, especially for people who are uncomfortable in that setting. Just sitting there and petting a dog and touching a dog, it releases good endorphins in your body. It makes you, that simple action of smiling releases all those good endorphins. And we found that it was very beneficial for people in recovery, people who were in treatment, to have the benefit of having a dog there if they wanted them.
What is your hope for the future for our Western New York community?
Well, a lot has changed in the last 10 years. There's become so much exposure to the epidemic that's going on, so much education available. I hope that, people utilize the resources that are available to them. We need to keep talking about this. This is a massive epidemic in our communities, a tremendous loss of life. And yet still people think it can't happen to them. And I can tell you, personally and professionally, it can happen to anyone. Doesn't matter where you sleep, how rich you are, how poor, whether you sleep on a park bench or Park Avenue, you're at risk simply because of the day and time that we are living in. And our kids are at risk. For some, it only takes once. One mistake can change their life and the life of their family forever, because it definitely is a family disease. And I think now that, society has taken a big look at how we need to provide support and services for family members as well as the individual who struggles with substance use disorder and addiction, we're going to see a lot more success, because no parent gets a manual. And I can tell you that my journey gave me transparency, honesty, openness. My son was present in my life. And I am forever grateful for that time that I had with him. But I still lost my son. And I think that the message, we need to get out there to people is, even if you do have a loved one who's struggling with addiction, there can still be beauty in your relationship. Tomorrow's not promised to anybody. The prevention aspect is 30 years ago, relapse could happen and likely people would get another chance to try again. We're losing that with the potency of the substances that are out there today, so we have to work even harder at prevention methods, because there is no cure once addiction grabs hold. And the drugs are so potent that it might only be one time.
Can you give us maybe one story, obviously without naming anybody, that you saw the difference it made in their lives to have the dog therapy and the services that you offered, how it turned their life around as one individual?
Well, I think, to name one individual would be very hard, because I don't think that I will actually get that, that answer until I meet the big guy upstairs. How many lives do I touch? How many lives do I change? I know that from personal messages that I get from people, or letters I get from schools about how impactful the messages that we bring. And especially with Luna is Christopher's dog, my son's dog. And he had her, I've had therapy dogs, for most of my life. But Christopher had Luna certified for therapy to work in his field of work. He worked with people with special needs. And he had her certified right before he passed away. So Luna became a Horizon Health Services therapy dog. Her tags came in the mail the day after he passed away. It was very bittersweet, sad. But she shares such an amazing message now with carrying his story. Christopher graduated from college. He had a great job with New York State. He worked recovery, yet he still died. And, he had his dog certified to be able to do wonderful things in the community for other people, and he still died. And I think that is a message of reality for a lot of young people, especially in our coalition. We have about 40 youth ambassadors that work in our coalition that take our message back into the community and the schools and share. And they all knew Christopher. He was a very big part of our community. So it's real for them. It's real to see, hey, this was a great guy who struggled with, a brain disorder that took his life. So, and having Luna to do those presentations gives us the ability to talk about a very sensitive subject. There are many young people in school now that have loved ones that struggle with addiction themselves. Some people have lost loved ones. And you're hitting a very tender area. But then you have Luna there who just walks into the crowd after the presentation, and all those emotions kind of melt away and turn to smiles. And I've received many emails and gratitudes, thanks for offering such a powerful presentation, but also bringing Luna there to be able to set the mood afterwards.
And as folks are watching this story, where would you suggest that they get help? Or what's the first step that you would give them?
Well, I think the first step is to listen to your gut and recognize warning signs. If you're feeling that something's not right, address it right up front. I mean, adolescent intervention is going to give you your best chance at long-term recovery. If we ignore the warning signs and we wait and hope that it's something that's going to pass, or we don't talk about it, it allows the disease to progress. And the more it progresses, the harder it is to get help. Not everybody who uses substances is going to develop an addiction, but some will. And when you have a young person who's, falling and succumbing to the peer pressure and the things that are happening around them, is it worth the risk? To take that chance to say, well, maybe they will, maybe they won't. I'm going to tell you, as a parent who lost a child, it's not worth the risk. Intervene early. Do what you can to put as much as you can between your child and substance use. Accountability can slow down progression, and it often can change, and we know that if the adolescent brain remains drug and alcohol free until 21, the percentage of developing an addiction drops drastically because the brain is developed. It's no longer that adolescent brain. And I think that's what we have to go back to, is we have to, say no, it's not acceptable, it's not allowed. We have to intervene and hold our children accountable if we feel that they're making bad choices, and educate, because it's not kids that have changed, it's the world they're living in, and it is a very dangerous place today.